reports of villagers experiencing severe diarrhea and vomiting after the community phase. Our priority is to assess the patients, identify the possible sources, and prevent the further transmission.
Yes, I will assist with the patient assessment and interview the affected villagers regarding their food and water consumption.
Before we begin, we need to follow standard precautions. Please ensure hand hygiene and use the appropriate PPE, especially because cholera can spread through contaminated feces and vomiters. Okay, let's assess our first patient. Sir, what are you experiencing?
The patient reports frequently water diarrhea and vomiting since yesterday. The patient also appears weak and thirsty.
These are concerns for dehydration. I will assess the patient's vital signs and level of dehydration.
I'll check for signs such as dry mouth, poor skin turgor, sunken eyes, and reduced urine output.
The patient is showing signs of moderate dehydration. We need to start oral rehydration solution immediately if the patient is able to drink.
If the patient becomes severely dehydrated, unable to drink, or develops signs of shock, the patient requires urgent referral for the intravenous fluid therapy.
Now we need to investigate the possible sources. When did these symptoms begin?
Most patients develop symptoms within last 1 to 2 days.
What did they have in common?
Several patients attended the same community feast. They also reported drinking water from the same water source.
This suggests the possible common source of outbreak. Contaminated food or water may be responsible.
I will record the cases and ask other villagers whether they attended the feast and what food and water they consumed.
Good! We should also identify the number of suspected cases, their symptoms, onset time and possible exposures. We need to prevent further transmission immediately. The suspected contaminated water source should not be used until it has been assessed.
We should also advise the community to drink boiled water or treated water and avoid consuming potentially contaminated food.
Correct. We also need proper disposal of feces and vomiters, environmental disinfection, and strict hand hygiene.
I will organize a short health education session for the villagers. Cholera is an acute bacterial infection that mainly causes severe water diarrhea and vomiting. It can also cause rapid dehydration and become life-threatening if untreated.
The most important treatment is rapid dehydration. If you have diarrhea, start ORS and seek medical attention, especially if you develop severe weakness, dizziness, reduced urine output, or difficulty in drinking.
To prevent cholera, always wash your hands with soap and water after using the toilet and before preparing or eating food.
Drink safe water, boil water when necessary, keep food covered and properly cooked, and maintain proper sanitation.
Do not prepare food for others if you have diarrhea or vomiting.
Based on our findings, we have multiple suspected cases with a common exposure following the community feast. This is consistent with the possible cholera outbreak.
I have recorded the patient's symptoms, onset times, exposure history, and the suspected common food and water sources.
We will report the suspected outbreak to the appropriate health authorities for the further investigation, laboratory confirmation, environmental assessment, and outbreak control.
We should continue active case findings and monitor the community for new cases.
Exactly. Our response must continue until the outbreak is controlled.